in learning, and that's what we're going to do this afternoon. This is actually the second series of the topic. Since the July 13, 2023 session, we held this. But more of this, I pass to our guest speakers. But before that, I would like to first request our chairperson of the membership committee and our board trustee, very hardworking Ms. Judy Wisenhan, to give us the welcome remarks and opening remarks.
Okay. Thank you, Cherry. So good afternoon, everyone, and happy Thanksgiving to all. I know some of you, I'm sure you came from your night shift, and some of you, this is the start of your shift. And thank you. We really appreciate you being here, and hopefully we'll be able to provide you the expectations that you're hoping to have today. So in today's topic, it's about building talent pool for PH health professionals. I know for a fact that talent is one of the factors to make our industry successful. The healthcare industry evolved a lot in the last 20 years, and there's lots of update changes when it comes to the type of talent that we're looking for in order for us to align our the requirements of our clientele. So in today's session, we hope that we'll be able to address some of the issues or concerns that the companies or the healthcare BPO industry is facing right now. The demand is too high, the talent is kind of little, and we're hoping that in this session, our speaker will be able to help us to give us some ideas on how we'll be able to really build the talent pool. We invited seasoned HR and talent acquisition people here. And I hope that all of you, even you're not part of the panel, we would like to encourage everyone to ask questions or to give your insights and comments. Before I go to introduce the charming moderator of today, I would like to remind everyone that December 7th is our last GMM for the year. And during the GMM, we will have our election day. And hopefully everyone can also enjoy and join the HIMAP board to celebrate our Christmas party. So this is our way of also thanking all of you to be part of the industry association. So without further ado, it is my pleasure to introduce to you a very charming lady. And she's been in the industry, I don't want to say more than a decade or 2 decades now, but her experience is really on training and development. He also did some account management and client services in her past life. And she's been doing performance management and all the gamut of the operational excellence in the BPO industry. And we're happy that instead of being in a company, she chose to be part of the IT BPM, which is our mother sector. And we need people like her. We need leaders like her. So I thank her personally that she, despite of her hectic schedule, she agreed to be in this session. So without further ado, I would like to introduce to you the Executive Director for Talent Attraction and Development of IT BPM, Miss Frankie Antolin. Frankie?
Thank you very much, Judy, for the very kind words. Ever enthusiastic, trustee of HIMAP and a partner of the IT BPM sector. I do represent IBPAT, our umbrella enabling association for the IT BPM industry, and this is very close to our hearts, particularly in the HIM sector. Before, we would say that the HIM sector in the Philippines is the up and coming, but now we're number one in terms of healthcare services. And so we want to make sure that we keep this leadership position. And that's why conversations like this are absolutely important. To start us off, I would like to introduce our presenter for this afternoon. He is currently the Dean of the MCU College of Nursing and was elected as the National President of the Philippine Nurses Association last January 2022 during the Philippine Nurses Association Board of Governors meeting. He was appointed in the year of centennial celebration of the Philippine Nurses Association with the theme inspired by a caring legacy transformed to lead. He is also the present incumbent PNA NCR Zone 2 Kamanava Board of Governors, currently serving his second term. His passion, expertise, skills, and essence make him the centennial president. Ladies and gentlemen, our members and our partners, please welcome this afternoon Governor Melvin Miranda. Hello, Gov. Good afternoon.
Good afternoon. Thank you very much to everyone. Magandang hapon po, and to the HIMAP and the IBPAP officers. Thank you very much for this privilege and for the trust again being me in the discussion of a very relevant topic, which is certainly related to the human resources for health and the pooling of talent. Just have a very brief presentation so that to give you just a situation and updates on how the Philippine Nurses Association translating all of these position papers into actions, and certainly and probably the HIMAP and the IBPAP can relate also not just only for the nurses but also to the health professionals in general. So again, thank you very much to the Healthcare Information Management Association of the Philippines. This second information session is expected to have already have some initial discussions with Ma'am. Basically, some of the informations and the situations that are really that are happening in the Philippine health professions. And to start with the situationer on the issues of the human resources for health, actually, it has been one of the concerns and number one issues that are really discussed in some of the government agencies that we have, all about the salaries and compensation. So in the Southeast Asia, even nurses and medical technologists had been considered as one of the critical medical profession or healthcare professionals here in the Philippines, seemingly encountering challenges when it comes to most of the great opportunities offered to our Filipino nurses and medical technologists. However, nurses are still in the struggle of lobbying to have our salaries be considered as one of the and by our legislators. In the Southeast Asia, one of competitive countries that really offered a very good salary and competitive compensations to our Filipino nurses for. But the lowest in Southeast Asia is the Philippines and Indonesia. It was already mentioned by the former OI of the Department of Health that we have 106,000 nurses that are lacking. However, this 106,000 as based from the World Health Organization's United Nations reference that for every 10,000 indeed we really need to consider 24.7 or 24 nurses for every 10,000 population. As of the moment, as according to the Department of Health, we have 16 out of 10,000 population. However, this 106,000 nurses needed in the country are based from those standard. However, we really need to see the reality that is really happening most in the regions and far provinces, specifically in the geographically isolated disadvantaged areas. And even the Department of Health revealed that most of the nurses who applied national capital region are from those provinces, which basically it considered also the perspective of the status, certainly on the economic factors, on the category of our professionals, including the nurses, as non-agricultural. In this perspective, in the regions, most of our nurses are being given with the minimum salary wage. That's why most of them are really attracted to apply in the national capital regions, wherein most of the premier hospitals are offering competitive salaries and compensation. With these 106,000 nurses, where are they? These are the common questions that even the Professional Regulation Commission, the Department of Health, and even coordinated with the Professional Regulatory Board of Nursing that we almost have as of the September 2023, we have 921,000 registered nurses, and only 26,000 are active, meaning those who are active are the ones who applied for the renewal of their licenses. And indeed, in the geographically isolated disadvantaged area, it augment the manpower needs of nurses through the DOH Nurse Deployment Program. Now, one concerns in the recent days of the news is certainly related to the health emergency allowances. Um, the Department of Health already revealed that there's still already arrears of almost 62,000 billion for our healthcare workers, including the nurses. And they have mentioned that they have already disbursed almost 50 billion, and the Department of Budget and Management appropriated 4 billion. So the concern here is that of some of the nurses who have supposedly received those health emergency allowances have already left the country, but the Department of Health already assured that they could still manage to process the disbursement of the health emergency allowance. The health emergency allowance had been in the provisions or stipulations of the Republic 11712, which was institutionalized and implemented by the Department of Health and specifically management. So one of the concerns, as mentioned by Yusek Tayag, is number one is still on the processing of fees. Number two, it could be the documentary requirements that are lacking by some of the institutions, local government units, and some of the healthcare facilities. And the third is certainly of some of the regional offices are encountering problems when it comes to the online application. So these are the three major concerns that had been addressed, but it impacted the compensation that are supposedly received by our healthcare workers. Now, it has been formalized and witnessed by the Office of the President just recently that there is a Department of Health and SHED joint administrative order to facilitate the hiring of the underboard nurses. So the SHED will be responsible for the subsidy for them to consider their review in some of the accredited review sites and facilities. And the Department of Health will consider specifically the clinical care associates to be hired in some of the private and the public healthcare facilities. There were issues that had been discussed in this concerns because initially the Philippine Nurses Association and the National League of the Philippine Government Nurses, NLPGN, had been involved in the initial discussion. one of the concerns that we have addressed here is on the legal imperatives and on the organizational structure. At first, on this proposal because the clinical care associates being under board is still not Republic Act 9173 of the Philippine Nursing Act. So in a realistic point of view, the clinical care associates who are under board nursing graduates will still be under the supervision of the registered nurses. On the legal imperatives, the safety of the registered nurses and accountability is really at stake on the performance of our underboard nursing graduates. On the other hand, uh, uh, chances of exploitation for the clinical care association may be assigned in some facilities. So one thing that we have demanded, actually requested of the Philippine Nurses Association, because we are in close relationship with the clinical care associates who will be performing their tasks in various healthcare facilities. So in this perspective, these are still on the table for us to discuss the implementing rules and policies, and certainly to prevent the exploitation of the associates while they are awaiting for their nurse licensure examination. Now, another Commission on Higher Education have presented I think 6 months ago on the enhancement of the our curriculum in nursing, and this is certainly to augment the uh, lack of the manpower or resources for health in some of the hospitals, specifically in the private institutions. Um, if you will check and if you will see in the proposed BSN nursing curriculum with credentials, uh, once a first year student have completed the level 1, they will be given a specific career path or role. Our objective here is to certainly consider the dialogue with the Philippine Nurses Association, which happened just recently with the invitation on the Commission on Higher Education, because the first year level of our students is still not immersed in practical task and clinical immersion. So certainly most of the setting that they could be involved is only in the classroom for the theoretical and the skills laboratory. It is very important to consider the actual interaction with patient so that we can assess the competencies once they will already be exposed in the hospital. But the certification indeed is structure of our educational system is still under the TESDA. So that's why this somehow cause confusion at the end of our stakeholders. So there are concerns like diploma. Uh, One of the careers that had been considered here is there could be roles that could consider community health nurse, associate maternity health nurse. I think if we will try to offer this for the level 2 and level 3 who will have the exit in these levels and can work already in various healthcare facilities, we really need to think about on how they will definitely be assessed and assured that they are competent to perform such tasks. So as of the moment, the updates on this is to certainly still consider the existing curriculum of the BSN first year and fourth year. This is still not implemented, but it is on the table for discussion. And we really need to consider again the protection of soon-to-be professionals, or possibly to those who will be undergraduate students who will be involved in the exit credentials. So seemingly this will really involve the consultations and dialogue with our stakeholders. Next is in particular since we have talked about nursing education in the clinical setting, hospitals, facilities, that we really lack now nurses. We are now really having this analysis that we have also our clinical instructors and nursing faculty, that most of the higher education institutions and nursing school experiences shortage, and thus this may limit the enrollment quality, considering the fact that we have or the need for the manpower. But again, let us also think for these nurses also who are also qualified to be given the opportunity. So that's why even the Commission on Higher Education have proposed one of the programs, specifically the graduate programs, in the actually in nursing education, mandate in our law that there must be a master's degree. So the consideration of the Commission on Higher Education is to propose a specific graduate program that will certainly consider po the qualification for them to be qualified for teaching. Again, this is still under the discussion of the Commission on Higher Education, but and again, we had been involved in this dialogue. Now, another concern is certainly on the proposal of some of the health. This was also discussed with the Department of Labor and Employment and Department of Health on the 8 hours and the 12-hour shift. On the perspective related to the 8 hours and 12-hour shift, the DOLE is only recognizing the 8-hour shift as based from the labor code, strictly from the labor code, and beyond the 8 hours will be considered overtime. However, the other proposed 12-hour shift will certainly compensate specifically on the number of days of work and number of days for our nurses and other healthcare workers to have their off duties, with certain association with their wellness, has the association also with some of the tasks that they could still manage with those days that they will consider as off duty. But again, as this was already proposed as an administrative order in the 2012, but the Department of Labor and Employment reiterated that still will be considered, but they are open for this discussion. Next, on the role of the Philippine Nurses, as the Philippine Nurses Association still considered in the position that in spite of some of these short-term solutions, we are still in the first three priority agenda that the government must take into consideration. Number one is the salary and compensation. The number two, it's all about the working conditions. And the third is all about the nurse-patient or staff-patient ratio. So in this perspective, those position papers had been cascaded already to the Office of the President. We are just awaiting for the schedule of the courtesy with these priority agendas. Now, that's why we have to voice and address the concrete solution now with other stakeholders, interest groups, and other organizations. With the priority agenda that we tabled to the Office of the President, still with the structure, the present structure we have on the implementation of our law, specifically on the salary grade 15, there is still in the local government units that still implement salary grade 11. So the situation of healthcare facilities on a perspective of different implementation with DOH hospital, which certainly depend on the national funding, and the local government units certainly consider and dependent on the LGU funds, and that is affected by the devolution. So even the Department of Health have introduced this National Human Resources for Health Master Plan of 2020 to 2040. So as a disclaimer, this is definitely a presentation coming from the Department of Health, and sectoral plan will consider policy and strategic direction as in accordance to the goals of the universal healthcare. So they have considered the areas of five, okay, and with this six rather, with these key result areas, it will the major concern that had been considered here in our discussion is the KRA 2, 3, and 4. On the KRA 2, it's all about strengthening and regulation, human resources for health welfare, and the human resources for health migration and reintegration. That's why even the have already mentioned po this data that from the enrollment up to the human resources for health with valid professional identification card. On 2014 to 2017, the enrollment is 47,906 enrollees from 2014 to 2017. And on the graduation from 2021, the average graduates are 10,246. And in the licensure examination from 2018 to 2021, the average Philippine nurse licensure examination passing rate is 2%. But in the recent nurse licensure examination, we have not conducted and administered the licensure examination last 2020. So, but we have achieved a higher percentage of national passing rate just recently of the May 2023 with the 74.9%, which is obviously which translated 1,503 of the passers with the source of the human resources for health across the regions. And as of September 2023, 526,300 has the valid PIC, which I have mentioned. Those active are for all for 126. So it added another 100,000. So for now, the human resources for health with valid professional identification card is 526,331. Now, on the perspective related to the migration, the average number of nurses migrating abroad annually is 13,078. With the 13,078, this was the data coming from Department of Migrant Workers, that with the 13,078, the temporary is 11,307 and the 771. And in relation to the salary of nurses in private healthcare facilities in the Philippines considered is the lowest, as what we have mentioned from the Southeast Asia. So from the salaries of the private to the public, the entry level for the public healthcare institution is the salary grade 15, which is 33,503. And in the private sector, it's on the average of the 14 to 15,000 of the disparity of the salary for the entry level. Another problem that had been addressed during our public hearings in the House of Representatives, the nurses are already enjoying the entry level of the grade 15, but since there is almost half of the disparity of the salaries in the private sector, this is one of the concerns that we have addressed provisions in our pending comprehensive nursing bill. So Department of Health emphasized the 8-point action agenda, wherein the Philippine Nurses Association had been involved. In the 8-point agenda of Secretary Herbosa, number 7 is mainly the agenda that is closely related with the human resources for health, kapakanan at karapatan ng health workers. That's why for every health workers, we're considering the number 7 and the kapakanan and karapatan ng health workers and protection ng anumang pandemya. So for now, we have already some of the discussion in the UP Law Center on the Magna Carta for public healthcare workers. So that's why we don't have yet the Magna Carta for the private healthcare workers. So that's why with the UP Law Center, they have initiated to consult the stakeholders, specifically on the perspective of the having the both public and private for the Magna Carta, and we have now the ongoing review of the labor code. So in the strategic interventions of the Department of Health, these are the top three that they have considered as priority in terms. So one is they have considered the increased availability of health workers in health facilities, institutions. Number two, strengthen capacity of health workers to deliver health quality services. And number three is improve working conditions of health workers at all levels of healthcare system. On number one, when it comes to increase of availability of health workers in health facilities, institutions, and communities, issues that had been addressed in the number one is definitely job security, because there are nurses who are in the grassroots who are still in the job orders and contract of services. Some of them who are in the nurse deployment program are for a 1 year contract and renewable for the these anxieties and concerns that had been addressed. One of the things that we are lobbying in the Department of for nurse deployment program. When it comes to strengthening the capacities for health quality services, we are promoting now to have the advanced practice nursing, so that to recognize our nurses' capacity and to have the specialization and to become specialists. So this has been the provision of the comprehensive nursing bill. And number three is on the improvement of the working. This is certainly part of the positive practice environment that we are as a priority agenda, because the working condition talking about is not just only the facilities. We're talking about certainly on the staff ratio to patient. We're talking also on some of the consequences of our nurses on their risk when they are in the active duty. So this could be the concerns, possibly the strategies that are being now considered. Scholarship for program and return of service, because as of now we don't have scholarship for from the Department of Health. In CHED, it's only available, but still it is embedded in the Pre-Tertiary Education Act. Another is upskilling of the program for clinical care associates. In this perspective, we really need to consider the registered nurses to be involved in this program. On the workforce, we really need to consider some of the regulations and legislations answer clear, to have a clear direction on the perspective of issues of our healthcare workers. And thus, if government will be engaged in the bilateral and multilateral agreements and negotiations, certainly we must take into consideration the return of service and will not deprive the healthcare system of the country. So that's why these four from the Department of Health have certain investment, monitoring, and policies are the four areas by which in the human resources for health. Policies, involvement of government units on the retention programs, specifically on how uh, the involvement of nursing education to practice, and on the policies is certainly on the benefits. Now, as to give you an update po, we have the Department of Health have already created the tech of nursing experts. This could be a recommendatory body that involves accredited professional organization, the academe, professional organizations, and other civil service organization that basically consider body to address some of the priority agenda that may need to act up. And definitely this will continuously support our comprehensive nursing bill, and soon that this will be enacted, this technical charge on how to set the dialogues on the involvement of stakeholders. So basically, we really need to move forward. And policy and strategic direction in nursing practice is very important, national and the international nursing trends. Strategies as the key issues, specifically in the decent work and migration, and the amendment comprehensive nursing bill. With this perspective po, I think the issues that I have discussed certainly will need to involve all of our stakeholders, specifically interprofessional collaboration, and hope translate into policies, ordinances in the local government units, enactment of the law that will protect our healthcare workers. Thank you very much and magandang.
Thank you very much, Gov Melvin. That was really a comprehensive presentation. We truly appreciate all of the initiatives as well as the updates that you have shared with us this afternoon. I know that this is definitely an ongoing discussion, and as you highlighted, it's really a multi-sectoral collaboration that we need, especially as you advocate for policy and strategic direction, both at the national as well as local levels, and all of the different groups at the government, industry, as well as the academic sector really banding together is going to give us some traction in terms of these policies that we are pursuing. So thank you very much, and we truly appreciate it. I would like to invite at this point some messages and reactions from the members of our panel. Let me introduce first of all Shrikant Lakshmi Narayanan, Vice President of Healthcare Center of Excellence at Sagility. Shri has been in the healthcare BPO industry for 23 years. Most of his experience is in operations management. He has been a part of business development, transition, and account management teams, and currently leads global engagement services practice and strategy. He's been in the Philippines for 16 years, so I'm sure he's very familiar with the local situation. Welcome to the session, Shri, and if you could provide us with your quick reaction and message.
No, thanks. Thank you so much, Frankie. Thank you so much, Governor Miranda, for the comprehensive coverage of the challenges. I think every 3-4 years, we have addressed this talent shortages in different ways, right? So trying to address saying that, hey, the shortage of talent is one through the academy, how many graduates that are coming in. Then the pandemic kind of made that shortage more acute for various different reasons. I think comprehensively, if you look at what has been the trend over the last 10 years, one of the data points that I was looking at is that the overall enrollment for nursing colleges or for students to enroll into nursing education has dropped by around 27%. So it's no more a choice of education or a choice of stream of work or stream of profession they want to choose. Partly it is because of how the setup is, all the challenges that the governor said, shortages of the nursing facilities in terms of salary disparity, so many challenges that you can continue to name. But what we need to do in terms of shoring up that people who think that this is a choice and this is a profession that they can go back into, where earlier the number of enrollees were much more higher. And that number, if we can improve that, I think that will be the first major success criteria that we could look at. Then you are looking at the cascading effects of attrition that Governor Miranda talked about, from enrollment all the way to they dropping off during the course of they completing their board exams and certifications. I think that is another major concern. But if you're losing close to around 35% of the workforce who have joined, that retention is also very critical. So one of the other problem areas that we have always addressed, or we have always talked about as part of our BPO, healthcare BPO or a nursing BPO per se, has been the gap between what we learn here and how they are future ready for the work. One is, hey, you have the certification, you have the licensure, but we also have to understand that there is investment that needs to be made by either the respective education community or by the private sector like us to make sure that these nurses are also future ready from what is required. Things like pharmacy, Governor talked about nursing population, but pharmacy requirements and licensed pharmacist requirements have increased tremendously in our domain, in our world. Today, for example, in Sagility alone, we look at shortages of pharmacists close to plus 500 plus based on requirements from our clients. That is one more area which is coming up. I think we need to probably quickly pivot to looking at the talent pool across the different life science elements and the clinical elements. Next is social determinant of health and how social workers are going to be engaged as part of even the basic healthcare facility that is being provided within Philippines, but also for our BPO engagements and work that we do for all the other clients. So those are two areas that probably need to be quickly be part of the solution and how we would address that, because that is an increasing area of opportunity. And if we have gotten into the problem areas in nurses, but I think if at all we also focus on other areas that are available for us to tap into, I think it'll be a good avenue for career progression for the clinical, clinical staff that is already available. So that would be my comment and kind of thought in terms of where we should probably also focus on. But looking forward to all the the action plans to be successful. I think one of the biggest challenges that we have also faced is the execution and the delays that has happened. The industry is moving much more faster than some of these executions that need to be happened. So looking forward to that as well and having more detailed conversation with the rest of the team.
Thank you very much, Sri. That's absolutely going to set up the discussion very well for this afternoon. At this point, let me invite our next panelist, Ms. Janina Borlaza, Vice President, Talent Acquisition, Brand and Marketing at Shearwater Health Advisors. Jen has 20 plus years of solid end-to-end experience in talent acquisition. She takes credit in building recruitment teams of startup, multinational, and well-established companies. As a Six Sigma Green Belter, she had the advantage of leading transformational projects in talent acquisition, setting up processes and rolling out critical talent strategies with strong business controls to ensure alignment with business goals. In the last 15 years, she has been in the business outsourcing shared services industry, leading teams with high volume requirements in corporate niche roles. She has managed global teams and mentored a lot of TA specialists who have been inspired by her leadership, passion for excellence, and positive attitude. Jen, welcome, and please provide your comment and message for us this afternoon.
Thank you, Frankie. So much has been said by my colleague here, Shri, and I'd like to also thank our governor, Melvin. We are very lucky to have a very passionate leader in TNA who's helping us out in bridging the gap and our agenda in nurse shortage. What President Melvin has shared earlier is something that is pretty much been discussed in so many forums. The compensation, the work environment, the nurse-patient ratio, the migration of nurses, and how we can stop or at least retain the nurses here in the Philippines. So I guess the presentation of Governor Melvin in terms of the solutions and what they have built, the proposed solutions and the people who's helping them out, it's very solid. However, the unfortunate situation that we are in right now, it has not been approved. We are still in the waiting game. So what is it that we can do to augment the talent gap in the meantime? Governor Melvin mentioned earlier collaboration with the industry. One of the things he also mentioned earlier is the return to service, which also can help in terms of retaining talents in the Philippines. So he mentioned about the 13K migration of nurses year on year, which is a very solid number. How can we address that? And how can we be able to incorporate, like, for example, is there a possibility for those nurse migrating outside of the Philippines? Can we request for them to have 2 to 3 years of hospital return to service while they would be allowed to go outside of the country? Is that something that is even possible for us to at least help in the nurse shortage we have right now?
Thanks very much, Jen. Once again, really appreciate our industry leaders joining us in this discussion. And we will definitely start get the ball rolling here. What's interesting is that in our panel, we've got different perspectives, or I hope we'll be able to take a look at different perspectives from sort of the end-to-end kind of talent management life cycle. There's so many areas that we can look at. But perhaps I wanted to start with maybe giving us an idea from the perspective of your specific organizations, what you currently are doing in order to address the more immediate concerns and how that's going to translate into your more long-term plans in terms of addressing the talent shortage. Perhaps we can go ahead and start with Sri to take us through from his organization's perspective, and if you can also share some of the success metrics that you're looking at as you drive those plans.
Yeah, the good thing and the bad thing, Frankie, is that we are all probably doing the same thing, right? That is one thing, right? So innovation from a hiring perspective has gone probably beyond the roof in terms of how you attract talent. I think the basic problem still remains for our industry on the BPO side is to continue to educate how it is not just a gateway to something to go abroad to learn something, but it is a career. I think that continues to be one of the major. It's not new. It's something that has been there for a long time, and that will continue to be there even later. Because when somebody joins a course and then completes a nursing graduation and gets their licensure, etc., they have to their immediate option or immediate focus is to serve and do well in what they have learned. But then to provide them an alternate career and make sure that they understand that that career is not a short-term option, but a long-term option. And for them to experience that. One thing is that you can talk to them and educate them. Then while you're onboarding and making sure that you're attracting them to your workforce, how do you keep them there for the first, say, 90 to 180 days is probably the most challenging one. And once you're off that hump and you are able to do a better job during that 180-day period, you tend to retain and you tend to show the value to the nurses that this is an alternate career option. So I think that is one of the focus areas for us, the onboarding. Attracting talent pool is always a challenge, and that we are all fighting for what we have in all fairness. So the compensation disparity, some creative means of attracting talent will continue to happen. I think the challenge is what happens after that. And the second portion of what happens after that is also how we are able to link what they do in our world in a clinical and link that to the clinical setting that they are doing. It's very easy to put it on paper, but very difficult to operationalize. We talk about, hey, we will offer weekend hospital work settings. We'll offer scholarships for you to do your continual education programs and all that. But to operationalize where somebody starts working 9 hours a day and they have night shifts, etc., and then have them go through all of that, that is a dropout rate that we see, and the fatigue factor comes in terms of, hey, I have to juggle between multiple different areas. I think our focus is to make sure that we are able to address those. And the other thing that I touched upon initially is for us to also, one of the things that we are doing is, hey, you're a clinician, and how can your clinical experience be used in other areas like pharmacy, right? So what is the course that we have? So we are trying to look at alternate educational opportunities, short-term courses. Partly we are trying to meet our own needs by doing that, but also this is kind of enticing to our nurses to do something different and learn something new than what they have, and that would be exciting. Hoping that kind of adds to the overall resume and the competency that they will have over a period of time. So I think adding value to their resume in terms of experience and what it means to them continues to be the challenge and will continue to be the challenge. And our focus has been on these two streams: first 180 days, and then how do you offer alternate clinical experience or clinical focus areas which can enhance their overall clinical acumen, would be the second, and those are things that we are working on.
Thanks very much, Shri. I'll pass it over to Jen, please.
Sure. So Shearwater believes that we can address the nurse shortage in the industry if we start helping at the grassroots level. So we started 2 years ago with our program, which is called Education to Employment Program, where we extend scholarship programs to deserving BSN students. So from north to south of the Philippines for this year, we have 53 students that we are paying 100% their fourth year tuition. On top of that, we'll also be paying for their NLE, and we'll be taking care of their employment after college. And if they would want to become USRNs as well, we will be supporting them, as well as the local board exam review that's also being taken care of by the organization. So it's an end-to-end approach in terms of really ensuring that we attract and bring back the interest of students to continue and become nurses without even thinking about the financial aspect. As we all know, the nursing course is one of the most expensive, I would say, at this time. So there are a lot of those who are really interested to become a nurse but would not have the financial means. So we're taking care of that. One of the interesting thing that we also do is that we have partner hospitals. I've mentioned to you that after graduation, we will be taking care of moving them into bedside experience. So there's a return service of 2 to 3 years in the hospital with our partner hospitals. So we've had a mutual agreement with these 18 partner hospitals because at some point we're helping them in recruiting nurses. They would also be retained in the hospital for 2 to 3 years. We are partnering with them in training these nurses, understanding that we have the SMEs from a Shearwater perspective on the US context and health informatics. And then we also support them in an increased engagement with the nurses. Right. Also for our CPO nurses who are in the BPO setup, those that are interested to somehow update their bedside skills because they have long been in the BPO sector. We also have the back to bedside program. We adjust their schedule so that they would have 3 days in their work week to be spent in the hospital, in the partner hospitals, and the 2 days would be spent in their CPO work. So adjustments will be made in terms of their schedule. I know that they are in the night shift, so we're trying to make sure that they would be able to do their hospital work at the same time their CPO work.
Thanks, Jen. That's really that's actually really creative, and I know that we've had to exercise a lot of our creative muscles in terms of addressing the need for generalist roles. It's definitely true, as Sri mentioned, from attraction to onboarding and retention. These are really key things that we need to address so much more when it comes to these specialist types of roles. And it's really heartwarming to hear about what specific organizations are doing. One of the things that I'm also interested in is how we can maybe integrate all of these different initiatives that perhaps Agility and Shearwater are doing and kind of take it to the industry level. Especially since we are, as was mentioned, there are certain similarities in the things that we're doing as companies, and so maybe from, and I'd like to invite back Gov Melvin in terms of what Shri and Jen have shared so far. Do you see any areas where we can perhaps integrate these initiatives so so that we can take a look at it more from a sector-wide type of approach?
Actually, I appreciated the sharing of Ms. and Sri, particularly on how we could provide opportunities for our nurse explore specifically this translation to somehow that will gear towards their curiosity on how they will consider specifically on the competency improvement, and at the same time it will open opportunities for them to have stable financial management. So in that perspective, we all know that here in the Philippines, some of our nurses are really in the BPOs because one of these opportunities are supposedly recognize these areas because the skills are also being recognized, and the knowledge of nurses in the BPOs, because the judgment and critical thinking are also being recognized as of their competencies as well. In this endeavor, I'd like to really extend my appreciation on the projects that had been mentioned by Miss Jen of having our local hospitals, specifically on the offering of scholarship and having the to those local hospitals, and giving also the opportunities for our nurses who are in the BPOs, but still they have the opportunity to upskill and upgrade their competencies in the areas of bedside. These are the programs that we could actually share to our legislators so that our nurses can definitely appreciate in the perspective of how we could say that nurses are satisfied in those opportunities even here in the. Thank you.
Thanks very much for that, Gov. Let me just read from the chat box here from Miss Ben Coronel. The water model is good, but we need the scale. Can the government provide educational loans, which is low risk since all graduating nurses have work waiting for them? They just need to get the 2 or 3 year hospital stint, and all hospitals will be happy to get them in. And I suppose this is something that we can carve into our current policy that we're shaping together with the different associations. And I wanted to just take a look at or highlight the scale that Ms. Beng has shared here, because this is something that we really need across the board, across our different organizations. The initiatives that we're doing are, we can't kind of do it in silos, right? We need to achieve the scale given the demand that we are seeing in these very specialized areas. And so this is a very good area that we can start with in terms of how we can transform specific organizational initiatives into something that is more long-term and get our government stakeholders to participate in a meaningful way as we go through our different initiatives. So thanks very much for that. Speaking of the different sectors and the multi-sectoral approach, I also wanted to talk about how we are currently enjoining the academic sector as we take a look at fulfilling or creating our pipeline. There are specific initiatives that we're doing in terms of, say, embedding curriculum, embedding training programs as early as the academe, and there are different ways in which we're doing that. Is that something that you are deeply involved in? I know that there are areas, especially, let's say, the Back to Bedside program that you mentioned, Jen. Is there any curriculum enhancement that you are currently doing at Shearwater and thinking about in the future as well?
Yes, there is something that is in play already, and we already have the proof of concept. We're also very fortunate to have a partner in Far Eastern University. It was, I would say, a 2 year discussion with them, looking into, they're also open into looking into their curriculum. They know that their curriculum needs to be updated, and we were there hand in hand with them, partnering in understanding what they need. So in the conversations we've had, one of the things that they've mentioned is that they need support in the curriculum, specifically on the course, which is healthcare or nurse informatics. So we jumped into that. It's a one unit module into the nurse curriculum, and we are partnering with them. So in the past 1 year or so, we have met more than 2,000, at least 3,000 students from second year to fourth year students of FEU. They've gone to our office, they've gone to our sites, and our training teams have been the one who is conducting the nurse informatics module. So what are the things that we are talking about? So they've mentioned they have no visibility in terms of electronic health records, EHR. They have no deep understanding about medical coding, utilization management. So we said, yes, we have our SMEs, our subject matter experts, and we'd be happy to do that for your students. So it's an ongoing project. We have expanded also to other schools. I'm also happy to share that we are already in discussion with FEU. They will be awarding us with a senior high school student because nursing is part of the STEM program. So that's deeper into the grassroots level. We would be very excited to do that, influence our high school students to go through the nurse course and nurse track.
Thanks, Jen. This is very exciting. Something that that we'll definitely watch out for. Shri, you mentioned earlier the not only do we need our talent to be globally competitive, but they also need to be future ready. So I wanted to also check in with you in terms of new skills that you think can be incorporated in the academic curriculum in order to achieve just that.
Yeah, I think Jen kind of mentioned some of the work that some of us are doing, and even in Sagility, right? We are partnered with both the schools where we serve in Manila metro area as well as in Iloilo, where our center is, to look at what we call as healthcare 2.0, which is what does it mean in the new age of healthcare, where how are things changing? For example, there is a course in Harvard, for example, which is only for telehealth. People are not aware of it. So how do we bring to fore what is the career that can happen beyond, and what are the specialization? What are the new trends? Recently, there has been a lot of question on AI across the clinical setting. So some of the sessions and the speaker sessions, which leads into part of their continual education program, is to make sure that we are educating them about what does this mean to the nursing population. How does technology go hand in hand with their clinical acumen? So that is an area which seems to be of vast interest, and this is not just from what the colleges talk about. I think this is also what the industry needs also in the future, right? So we are serving both the purpose, and the most important point is that students who are enrolling are much more excited about these opportunities of learning. Because they relate to that far more. Yes, they love the bedside. They love this service that they provide to the patients. That's the core. But I think how the technology enablement can influence that and enhance their clinical acumen. So those are courses that we are working on. So for Jen talked about, say, utilization management, telehealth, if you look at it, case management support. Some of these are very specific to certain areas and the markets that we serve. And how do you put a global setting into saying that, hey, what does utilization management mean? It's not that it's a term which is used differently in the US geography, but even within our respective areas, we always get referred by doctors to some other doctors, right? So how do you bridge that, and how do you bring that all together and educate them? So we have partnered with schools where we are trying to use these as educational units as part of their curriculum. They are the students who show the keen interest to share that, hey, there is scope beyond what we do in the nursing. There are at least 3 colleges that we work in the Iloilo area, and another 2 or 3 in the metro region. And our HR team normally looks at our current both the clinical team as well as our technology side to come and talk about all these and prepare curriculum design to make sure that we are able to address those needs, so that we do a good handshake of the technology and the clinical area. So that has worked well. There seems to be a lot more interest in the student population also on those courses. The reason why we call it Healthcare 2.0 is that how do you adapt yourself and raise your competency levels on technology while you're staying in the clinical setting is something that we feel will attract more talent pool to the stream, which is really needed for all of us.
Thanks very much. And that's definitely part of our career advocacy, being part of the IT BPM industry. It's really, we have to be multidimensional in terms of the domain as well as the digital expertise. And so being able to attract talent and starting that advocacy even as early as senior high to get them interested is one of the things that we can definitely do for a longer term. Once again, I'd like to go to the chat box. Would also like to invite the rest of our attendees, if you can put in any comments or questions so that we can, bring you into the discussion. We'd love to hear from you. Ms. Beng, the government or PhilHealth needs to mandate that all healthcare institutions have to adopt EMRs in treating patient cases. Data is healthcare currency, but we cannot take advantage of healthcare data since not all hospitals implement EMRs. I wonder if I can invite Gov Melvin to react to this statement, please.
Yes. Actually, as mentioned by Miss Jen, that we really need to have the immersion of our students, those that had those concepts in the our nursing informatics. Actually, in all allied health are already embedded, but our concern is really their immersion on the real world, on how this could be more appreciated as part of the learning opportunities. And I just want to take into consideration also that some of the hospitals are still not embracing the technology, specifically on the hospital information system, and some are still on the of their operations. That brings flexibility on our human resources for health, and that's why we are as a flexible and definitely trainable health professionals. But indeed, we need to move forward. As mentioned by Sri, we need to have the skills upgrading for the AI, and we are gearing towards the fourth industrial revolution. We have already experienced it in the last pandemic, in the education, and at the same time in our practice. So I think we really need to be more prepared as to for us to be more technically immersed. Just like in our institution, one of the concerns of the government now is to really appreciate roles of nurses in the implementation of universal healthcare. That's why, as part of our curriculum, we immerse them in the geographically isolated disadvantaged area. Could really appreciate the role of nurses, particularly if they have scarcity of resources, lack of manpower, so how they will dealt accordingly. So this will definitely engage them in these situations. So other than that, in our situation also in the nursing profession, just like the professions, pharmacists can have their own pharmacy. Dentists can have their own dental clinics. The optometrists can have their optometry clinic. But here in the Philippines, we don't have a recognized nurse-led clinic. So hoping this direction could be considered part of an extension program that will also help our nurses to appreciate entrepreneurship and expose them own as part of the professional practice. Thank you.
Thanks, Gov. Definitely different alternative areas for practicing the profession that they studied. You mentioned entrepreneurship, but there is also in the bedside care, of course, and then the clinical process outsourcing. These are ways that the profession can be practiced, and we can't educate the future workforce enough about these different ways in which they can put their studies to life, so to speak. One of the things that we at IBPAP have been really watching out for is how the we can't say advent of AI anymore because it's already here and we've been feeling it for several years now. But I'm really interested from the perspective of our industry practitioners and our industry leaders, how your integration with, or at least your framework for AI has affected the way that you're also building talent and preparing your workforce. Perhaps we can start with you, Shri.
Yeah, it's a good point, right? I think a lot of we have looked inwards for AI to start with. I mean, when we say that, in the sense that how can we use AI to enhance the competency levels, enhance the knowledge, fasten the training, do your courses faster, how AI and nurse assist solutions kind of help that tremendously. So we have been able to invest on technologies that will do some of the courses and the training that they go through in healthcare and the clinical process outsourcing. Some of the trainings could be longer, and that kind of leads to fatigue factors in some of our nurses, and also the retention of trying to merge with what they know and what they need to learn new. And they've already gone through multiple college courses and other stuff, right? So they don't want to sit in training anymore. So I think AI, we have used technology, AI specifically for what we call as nurse assist. That has helped tremendously in terms of knowledge retention, and successful nurses will also mean that less attrition. I think that's generally true for all professions, but it's true here as well. If they feel that they are going to be successful in the clinical process outsourcing, they are better equipped, they are well trained, I think they will continue to stay. And that's the way we have looked at the AI. And purely also on the job, creating tools which will make them successful, and use them for what is purely necessary from their skill perspective. What do we need them for is that clinical acumen. One of the things that we have, which has happened in the past, is that most of our clinical process outsourcing, in some areas, there has been a lot of administrative tasks, and some of the nurses get discouraged by it, saying that, hey, this is not purely clinical. This is probably a lot more administrative as well. Some do like it, but some don't, and some want to. And I think if you are able to use there is multiple such products in the market. And for example, Sagility has looked at what we call as an intelligent content processing, which is a tool which kind of helps the nurses to manage clinical abstractions so much better and utilize purely the clinical acumen, and build it with the clinical policy guidelines of our clients to make sure that they are able to understand. So I think if you just look at what I talked about in the previous segment of Healthcare 2.0 for people, students who are joining the courses and doing those in schools, and you need to see that through once they join. You talk all that during when they join, and you don't see that when they come to and join your workforce, you don't use those technologies, then they are going to be not so encouraged. So that's how we have kind of mapped out the roadmap to say, how do you experience what we are introducing? And so these are AI tools which has happened. There are still question marks. For example, if you really look at it, healthcare has probably adapted to AI far more faster when compared to the other areas. Everybody says it's probably the last, but no, there are a lot of robotic surgeries which has happened far more beyond the so-called the new wave of AI. It is going through that hype cycle, as everybody says, but I think the most opportunity we see with AI and technology is how it enables the nurses to do their job much more faster, efficient, so that they focus on what they like to do the best. I think that has helped tremendously. And one of the other things on the Sagility side is population health management as part of clinical process outsourcing is huge. And how do you use analytics to help nurses make those choices and decisions? There is always that, I don't want to call it gray area, subjective element of utilizing their skill and knowledge. And how do you enable that? And how do you achieve that? And that clinical analytics is one more area. And today, one of the things that we have done is make sure that those career progressions are available to those nurses. For example, if you want to join our technology division as part of a clinician, you need those expertise to say how it really works, and those are our analytics team has multiple clinicians who are help building some of these products and enhancing these tools. So one more stream of, to governor's point, how do you give alternate options and enhance their skill? Different ways of how we can take one step at a time to expose them to different areas.
Thanks, Shri. From your perspective, Jen, I guess as early as talent acquisition, even maybe as early as sourcing, as you onboard and look at talent management, what's your perspective?
Yes, that's right. So as early as recruitment, there's the use of chatbot, and it actually helps us in a faster turnaround time with the applicants processing and making sure that there's already the sifting process in place at the early start, and also for candidates for them to not wait that long, given that they would be instantaneously engaged by the chatbot. I agree with what Shri mentioned earlier, because the things that we've seen in operations is really more of automation. We've seen some organizations and our clients in doing automations, and this somehow will also help us prepare in terms of what kinds of skill sets we would be needing in the future. Like for medical coding, I'm sure there would be machine learning that's going to happen in the future. It would be very easy for a medical coder to process transactions. But I think it's still in the early stages right now. Definitely would still have to prepare. Maybe in the future, what will happen is that we will be providing audit as a service rather than medical coding. So folks would have to audit the codes rather than coding it itself.
That's very interesting, and thanks for that, Jen. I think it's really up to the current experience of the different organizations in terms of how we're going to move a little bit faster and get ahead. I know that there are recent conversations about not recent. Let me rephrase that. There have been certain conversations around this industry being sunsetted because of the emerging technology. And this is quite the opposite of what we're seeing. There's so much more opportunities out there. It's really more of us taking advantage of the current situation in order for us to move forward. So if we were to take a look at maybe a wish list coming from the different organizations, we've got industry associations present, and we've got advocates that can speak to government as well as allies of government in terms of what we really need in order to ensure that we continuously build our talent pool, we plug that talent gap as we also start to think about how we're going to prepare for the workforce. From the perspective of IBPAP, we're always looking to continuously quantify the demand. We know what the overall demand is, but we also want to get into the detail of exactly how we can work together with our partner associations, with the academe, as well as with the government. So keeping that in mind, are there any particular areas of support where you are looking at, Shri, in terms of how Sagility can address this never-ending, it seems, crisis on talent?
Yeah, I think Governor had mentioned all the action plans. It's not that people have not thought through, right? So frankly, I think solutions are there for us to see. I think the problem has been the execution, the speed of execution. And that is one where we need to put lobbies, support, organizations like the Nurse Association that the governor is leading, to make sure that we are able to influence the government. And two, if you just look at the data that the governors were sharing in terms of benefits not being shared, the nurses' compensation not being fulfilled, we are not helping our cause. No wonder 27% low enrollment, right? Because if the existing population is not getting their dues, then you would not expect new workforce to join, because it's they are not just doing this for service, but they also have to take care of themselves. So I think that's an important area, that the current gaps that needs to be fixed. I know it's very easy for us to say, but budgeting at a country level to manage all these through the pandemic is difficult. But I think that's an important point from an execution standpoint. I think as an industry association as well, I think if you just look at this panel between myself and Jen, we are almost saying the same things in different ways, but there is still no cohesion, right? There is still no cohesion from, hey, we'll bring in the entire force and say we will address, instead of we doing it for 3 colleges, FPU here and say Ateneo here, and we going into some other university in UP, for example. Let's say that all of the entire industry has to work with all the colleges, all the academy, and say everybody and every college should do A, B, C. It is in our selfish interest that what we are doing, we understand. But I think there is a question from Ben, which how do we scale it up? For you to scale it up, unless you bring the associations that we are all part of and say that, hey, we will talk to every single university. This is the association, and we will lead, and we will create this curriculum. We will create this new continual education unit, for example, whatever it might be. Unless it reaches to almost every single area, the scale is going to be in pockets. And I think the industry has much to do in terms of bringing the cohesion and making sure that we are collectively addressing rather than just being addressing it through point solutions as we have done. That's when the scale will happen. So those would be I would say, 2 asks, one for ourselves as industry and one for what the government and others could do.
Thanks, Shri. Over to you, Jen.
Yeah, I'm aligned to what Shri mentioned. On top of that, I recall, Frankie, when we had in IBPAP many years back, when we were saying we need X number of talent who would be able to have excellent communication skills. What IBPAP has done is really have gone through TESDA and have given several trainings and even tapped into organizations that could train the faculty team and provide those programs. So there's really that engagement and partnership between IBPAP and the schools, and the openness from the schools as well, right? So I think that's one of the things that I'm looking forward to. Very recently, I think a year or 2 years back, TESDA has provided certifications on medical coding. We were part of that. We were very excited to take part of that initiative. However, we were not able to hire anyone. And the challenge there is still the curriculum that is being presented by our partner training houses is still not matching to what we are requiring. We are very open. You have heard me say Shearwater is very much open to share our talents, our subject matter experts to really help out in building the curriculum so that we can bridge the gap and make them more employable.
This is great to hear. And definitely we want to augment all of the different efforts and scale up those that have been successful in the past. For the perspective of IBPAP, we're actually looking at it from different fronts. So just a little bit of sharing right before I go over to Gov Melvin. From the academe side, we have piloted a direct embedding of curriculum into higher education. And this is something that, to your point earlier, where we don't have to go school by school, company by company, we really want to be able to approach this at the industry level. And what's key for these different initiatives that we have with the schools, as well as with specific training providers through TESDA, even the work that we're doing as early as senior high school, doing our career advocacies, trying to make reforms in terms of internship and immersion as volunteers. We're always lacking for volunteer organizations. So very happy to hear that we can definitely tap into the folks that are present here to join our different initiatives. And so we'll continue to communicate and we'll continue to advocate, particularly on the cohesion and scale. That's really important as an industry, so that when we present ourselves to government, then it's really about ensuring that we stay focused and we stay targeted in terms of the execution. And we know that there's a little bit of opportunity there to, that's a bit of an understatement, but opportunities really in terms of the execution. We've had stops and starts. So I wanted to hear from Gov Melvin, if you can share with us any aside from some of the maybe wish lists that you have for the organizations, for industry associations, but also your perspective of how can we, get over this obstacle of like push and pull when we speak to government, or some of the delays in execution.
Probably if we could start with we could probably strengthen the academic industry council, higher education institutions, because basically academic industry council can invite the industry partners for the review, and specifically have the execution on some of the opportunities for them to be immersed of some of the facilities that we could offer. This could really translate into a higher expectation attain the competencies. Other than that, for the industry is the industry government agency network. It is very important because the involvement of in government agency network such as partnership will not just only end up with memorandum of agreement. It should be will end up and into an outcomes such as long-term projects, retention plan will really engage our nurses to think and capture or embrace those opportunities as well. So it was mentioned that the concern is really execution. That's why we really need to have the strong partnership with legislators, because they're the ones that will really be considered as the key for the implementation these challenges that we are experiencing in the profession. Once this will translate ordinances, policies, and it will be enacted into law, then let's go back again to the academic industry council, the industry government agency networks, for us to be together in the some of the execution that we are expecting. Just like for the Department of Budget and Management, they cannot execute things supposedly for our professionals without any legal basis. Some of the Department of Health cannot definitely put in place the concerns of our nurses in the private sector, simply because the Department of Labor and Employment is the one supposedly giving the solutions for them. So I think those that are not being executed as part of the plan into projects that are very concrete and must have a long-term projects that will benefit our professionals. Thank you.
Thanks very much, Gov. And I'd like to go back to you actually, and maybe just give us some final thoughts and the final message as we wrap up our panel discussion.
Thank you very much for and having this platform as our way of addressing our concerns, especially in the talent pooling. I really appreciate the sharing of Miss Jen and Sri, some of their projects that will really help the education sector and our when it comes to the industry of our nurses, hoping that we could have a more partnerships on these endeavors. The Philippine Nurses Association is very much open, and with your associations as well, for us to be together, have one position in dealing with these challenges, and will definitely support and with our involvement as the accredited professional organization, we're really open for all of these opportunities for us to move forward. Actually, the PNA have reached 100 years. We have already set the legacy. But for the future of our healthcare system. So hoping this future will be translated into something that will be more productive and more realistic for our profession. this platform, as we continue with our advocacies, I this could be more realistic in a way that we move forward with our endeavors. Thank you so much.
Thanks very much, Gov, and congratulations on your 100 years. Shri, some final thoughts, please.
No, sorry, just a minute. My internet is off. So, Frankie, no, thanks, Governor. Thanks for going over the details that you have. We need the associations like yours and leadership to continue to lobby and press forward in terms of what we need from an execution standpoint. I think that is very critical, and that will ensure that at least we are able to solve some of the problems. I think one of the other comments that you made struck me is like, hey, let's not just sign memorandum of understanding, right? So I think we have all had partnerships and MOUs signed and pictures taken, and there is action to be done. I think that if all these forums help take those actions and help lobby to push people who are supposed to take actions, in some of it we are responsible as well as industry leaders, and in some we need government support completely. I think if those actions if it translates to meaningful outcomes, I think that will be the success criteria in terms of ticking off. Hey, we had 8-point agenda. We have completed 1 in first quarter, 2 in second quarter. I think that is what we want to see and say, hey, what does this mean to our industry later? So thank you so much for the opportunity. Thank you, Frankie and Jen.
Appreciate it, Shri. Jen?
Thank you. Well, first of all, I'd like to also thank HIMAP for providing us a platform to discuss our issues, share our best practices, and hopefully together we can work in arresting the issue. Healthcare has become a personal issue to all of us, not just our communities or at the national level. During the pandemic, we've lost a lot of healthcare professionals due to the virus, or maybe because the profession has become in demand, they migrated to other countries. So as an organization, we have found an obligation as a healthcare organization to help the situation and put all our efforts in rebuilding the nurse profession from grassroots level and until they serve the Filipino community. So while we are waiting for the solutions and the proposed solutions of Governor Melvin to be actioned by the government in our own small little ways, we're still continuing to do that, and hopefully to partner with IBPAP and our colleagues in the industry to work towards the issue and resolve this.
Thank you very much, Jen. Couldn't have said it better myself. The insights here has been very helpful, especially for us in IBPAP as we continue to partner with HIMAP and our colleagues in the industry. There's really so much more that we'd love to talk about, but there's not enough time in the world. And so just to quote Ms. Beng in the chat box here, execution is really key. There are several recommendations. There have been several actions presented. So it's really just ensuring that we as a community will continue to work together and ensure that we stay focused on our goals and our targets. And we'll definitely, from our perspective in IBPAP, we will definitely be reaching out to HIMAP and its members to continue to put together the different recommendations, initiatives, and more importantly, help needed as we go through these different actions, as we are working on more long-term solutions from a government and policy perspective. It's true that there are some things that we can do together while we're waiting on some of those actions. So maraming salamat. Thank you very much to everybody. Really appreciate the time. Jen, happy birthday. Thank you for spending it with us. Gov Melvin, maraming salamat as well as Shri. Thank you. Over to you, Cherry.
Wow, fantastic. Thank you so much. And there's so much that we learned today, so many key takeaways. We are always grateful that the 4 of you have been our constant support in these platforms like this. And this is one of the reasons that we keep on thriving, because of the insights and the best practices that you keep on sharing with us to develop the industry. Thank you for obliging us once more, Jen, Shri, President Melvin, Governor Melvin, and of course, Frankie. Thank you for that update that you're having with SHED and the rest of the academe institutions. Thank you. We will keep on connecting with you to the next partnerships that we will have. So once again, we are very grateful for all those insights. So again, thanks. And at this point, I would like to turn over to our board trustee and the co-chair of the Talent Development Committee of HIMAP, who is also the Senior Vice President and Country Head of Access Healthcare, Sir Rishi Pradhan. Over to you, Sir Rishi.
Sherry, thank you. So good afternoon, everyone, esteemed guests and valued participants. So Frankie, firstly, amazing facilitation as always. You helped create a certain space where we could see a very rich exchange of thoughts and ideas, right, which allowed the session to be very engaging and impactful. More than that, I think what we also saw was that every voice was heard today. And especially looking at the way it has contributed to the overall dialogue. And personally, me and we at HIMAP are sincerely thankful for that. So as we bring the second series of building a talent pool for Philippines health professionals to a close, a topic very, very close to my heart, plus the fact that from a BOT standpoint, I am the co-chair for talent development, right? Deeply touched by the way the discussions went, especially considering the profound impact that it has on our healthcare industry. And like Jen, I believe, said towards the end, it's not about shortage overall. I think it's mostly about the rebuilding of the nursing talent in the Philippines. Because if you look at it, the shortage or the rebuilding of the nursing talent in the Philippines is not just in particular industry concern. It is something that is cross-sectoral, like Frankie did mention, and it's great to hear the partnership and the sincere efforts that are being made to address this. I wanted to express my gratitude to our esteemed guest speaker, Governor Melvin Miranda. Welcome back again. And the distinguished panelists, Shrikant and Jen. The insights have not only been very informative, and great to hear about the initiatives that are being run by organizations like yours, whether it's about partnering with local hospitals, working with the academe to help shape some of the curriculum, or especially with regards to nurse informatics, the sponsorship that he spoke about, where we're able to create a platform for our nurses to advance their continual education. And the main in all of this, right, we still help as multiple organizations and as the industry bodies to provide a very stable environment for them to continue to work and thrive. And along with it, we did hear discussions about how the immersion and the actual usage of technology is going to be helping not just bring all of the talent that we currently have at to a certain maturity level from that perspective, but also in terms of upscaling. So, and it's great to hear about the different thoughts that came out as far as how organizations are looking at it, how industry organizations like IBPAP is continuing to support it, and especially with all of the engagement that we have with the members that we have on this call today. I'm very, very confident that given the collective attention and commitment, right, we'll definitely be able to go back and really look at how do we really rebuild and continue to enhance the nursing talent that we have. And then thinking about from a broader concept, if you look at it, HIMAP has and will continue to play a very pivotal role in terms of addressing the talent shortage of the nurses as an organization. Not just do we go back and help organize such forums for discussions. We are also an active participant in shaping the solutions for our industry challenges. And we are very committed to going back and looking at creating initiatives that will continue to help build a very robust talent pool for the health professionals in the Philippines. So as we conclude today's event, and Ms. Beng did also go back and mention in one of the chats, a call to action for each one of us, right, is to kind of carry the insights that is gained over here today go back and work with the organizations that you're currently in and the communities, and look at solutions to how these challenges can be addressed. How do we take a very collaborative effort, and then how do you really then go back and take a very shared commitment to go back and look at not just doing within the organization, but at the same time continue to use forums like these to go back and really share some of the insights, best practices that we have had, because as an industry, that's the way we need to thrive. I know Sri did go back and mention at one point of time is the same talent pool that everybody dips into, but I think what we also really need is to make sure that how do you continually go back and keep on beefing that up and making sure that, right, at the end of the day, there is a very clear roadmap that is there for the entire nursing talent that we have in the Philippines, which is what Philippines is really known for. So again, like I said, I think the way to address this is take a very collaborative effort and then a shared commitment among us, the members. And the other thing I wanted to talk about, and I know Jyoti mentioned this in the beginning, is please do mark your calendars. There is a general membership meeting happening on December 7th. At the same time, where we'll also be conducting the Board of Trustees elections. So I would encourage all of the HIMAP members to actively participate in the process. There is an email that has been sent earlier by Sherry, who's our executive director for HIMAP. And the only way that we would really help in the process is in terms of having you participate and at the same time contributing to the continued success and the growth for industry. So in closing, again, I would like to extend my deepest gratitude to each one of you for your active participation and engagement in today's event. As you've seen and you've heard, right, the collaboration and the commitment that was demonstrated here today really sets a stage for a lot of positive change. And I know, having been around, worked in the industry, if you're together and with the unwavering support that we have of the members, IBPAP, HIMAP, and all of the member companies that we have, will not only help build a sustainable talent pool, but at the same time create a very thriving future for the healthcare BPO industry in the Philippines. Thank you, and I look forward to seeing all of you at the general membership meeting on December 7th. Over to you, Jerry.
Thank you very much, Sir Rishi. That's a very encouraging closing remarks, and for the reminders of the next events that we hope they are together with us. So wonderful. Thank you, Sir Rishi. We are happy that you're back in great shape. Yes, yeah. Thank you. And I'd also like to acknowledge with a gratitude and thanks to our committee chairperson of membership committee, Ms. Judy Wisenhunt, and the members of the membership committee who is also here, Ms. Jenny Marshall. They are spearheading these information sessions on a monthly basis for the year. Thank you, and we hope to have you again in the next event. May I request everyone to open up their camera for a souvenir photo.
There you go.
Yes.
Yes.
Yes. So we can have
Nice to see some familiar faces here. I saw Joy Lanillo. How are you?
Hi, nice to see you here.
Welcome to HIMAP.
Yeah, nice to see us.
Yes.
Yeah, the faces I've yeah, wonderful to have
Yes.
members and
Thank
partners
you from
here,
the
Ms. Judy.
row.
Yeah.
Yes.
And industry colleagues, thank you. So we're taking the shot now. I am joined by my colleague also at the Secretariat, Kathy Olaska, to help me in the photo shooting. Kathy, open your camera. Okay. So at the count of, all right.
Happy Thanksgiving.
Happy Thanksgiving. Yes. Okay, at the count of 3, 2, 1, smile. All right, there you go. But I need one more shot to make it sure. Yeah, so one more time. Okay, everyone. Another one. At the count of 3, 2, 1. Smile. All right, there you go.
Thank you
Thank you
very
once
much.
again, everyone.
Thank you,
Miss
everyone.
Judy, final words. Miss
Yes,
Judy.
no, I just want to thank everyone for attending this. This is our last session for the year, but there will be more collaboration with the other sectors. I hope and pray that we'll be able to meet all the requirements of our global clients. So thank you again, and happy holidays. Happy Merry Christmas.
Advance
Okay.
yeah, Merry Christmas. Thank you
And nice to see
Bye.
everyone here.
Thank
I can
you.
see Faith,
to our guest
Pedro.
speakers.
Yes,
Person
thank you to the guest
loving.
speakers, our panel, and Chris
Frankie.
Frankie.
Yeah.
Thank you.
Thank you
Jen.
so much.
Jen, happy
Usually.
Thank you.
birthday.
Happy
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 birthday,
birthday.
birthday,
Jen.
Jen,
Jen.
happy birthday to Jen.
Thank
Happy
you.
Happy birthday,
birthday.
Jen.
Happy birthday
Birthday
Bye.
to you. Yeah, we should have.
Happy birthday, happy birthday, happy birthday, Jen
to
Vargas.
you.
Love
Thank
you.
you. Thank
Yes,
you.
Happy
happy
birthday, Jen.
birthday.
Thank you.
And now take your vacation.
Bye.
Thank you.
Thank you. Okay.
Yes, bye everyone.
Bye.
Thank
Jenny,
you.
Marshall,
Miss
thank
Jen.
you.
Thank you. Bye-bye.
Thank you. Thanks, Miss Judy. You